I was able to study spontaneous remission, and I was able to work out how and why it happens, and I was able to replicate the mechanism in order to cure people. My technique is called induced remission therapy, and it is the replication of the miracle that happens. But instead of looking back in awe and thinking, oh, it's a miracle, I studied it, and I know how it works, and I apply it.
A multi-million-dollar judgment, but the possible cure remains missing and people continue to suffer.
It had promise of being one of the most effective treatments for AIDS and cancer in history. Now it's gone, and one of the most respected research facilities in the country is being blamed. Imagine being near death from cancer or AIDS. Suddenly, a miracle appears, a vaccine that all but cures your disease. Then you learn the very thing that's saving you has somehow disappeared. A federal jury says Cedars-Sinai Medical Center did just that. They've awarded a $10 million judgment against the facility. The man at the center of it all is Australian Dr. Sam Chachoua. His treatment of cancer and AIDS is revolutionary. He uses infections like the flu.
Your body and my body can't fight cancer, they can't see cancer, but we can see the flu. So if the flu is attached to the cancer cell, our body will attack the cancer cell.
It took him 12 years to develop cultures that did just that, attach themselves to cancer and AIDS organisms so the body could destroy them. The results were a knockout, and Chachoua decided to hire Cedars to catalog and research his work. A short time later, he got a letter from them describing the vaccine as producing a profound inhibition of infection from AIDS. Then things started to change.
And then within 3 weeks, I received a letter saying, we're stopping testing with you because we've received information that you're using our name to advertise.
And you were not?
No.
Then came the second blow.
They claim to give it back to one of their individuals from Cedars, and those cultures have now disappeared.
Even more dumbfounding is a letter dated January 13th, 1997 from Cedars-Sinai to Chachoua's lawyer stating they never had any agreement with Dr. Chachoua concerning those vaccines. That despite the fact that the letter from Cedars describing the profound effect from the vaccine was dated June 1996.
I contracted HIV since 1980. I was told that it is now the transition stage of being the blowing full AIDS. I was walking but with a cane, which I went to Robben Island. I was saying that I'm going to visit Robben Island for the last, then I'm going to die. And he treated me. The next day, they gave me shots. In 2 hours, I was not limping anymore.
So you were able to walk?
Yes, I was be able to walk. After 3 hours, I felt much better and I could eat nicely because I couldn't even eat. 6 days after treatment, it was 6 treatments that I got. Then when I looked myself into the mirror, I was not seeing the Patrick that came on the 14th of November. I don't know where the cane is. What happens to the cane that I came with it? I don't know where is it.
I was diagnosed February 14, 2013 with rectum cancer. I had a colonoscopy and they found a tumor in my rectum. After that, I went to chemo and radiation for about 8 weeks, twice a day. And then after I was done, they wanted to have surgery on me to remove my rectum, my posterior vagina, and part of my colon. And I opted out of it. They threatened me and told me I probably will be dead by June 6th of last year. And I said, no.
This is the tumor. And what you just saw in her toilet was the tumor. So she actually pooped it out. It died and it fell out. So those of you who would recall, the colonoscopy appears exactly the same as the stool matter we just saw. And what had happened is Madonna killed her cancer and passed it in her stools. For the life of me, I can't see any cancer in her most recent picture, which was taken yesterday.
You mean it's gone?
It's gone. It's gone.
Thank you.
About a week after my father died, my mother got diagnosed with cancer, and she had ovarian cancer, and she had 3 months to live. And she came to Dr. Sem, and Dr. Sem healed her.
So she's fine now?
She's 100% hunky-dory.
Do you know if she's gone to another doctor and see if there's any sign of cancer?
She went to 5 clinics.
After Sam?
Because she didn't believe that she was healed. Everybody kept telling her that this was not possible. And doctors actually threatened her at the end that she was misrepresenting the medical community because no person could be healed from cancer. So she pushed the envelope too far because she had difficulties in believing it, and she's not allowed to come back to 5 clinics.
Well, the problem though is they gave her a 3-month
diagnosis.
A prognosis of 3 months. They thought you'd be dead in 3 months. And how long ago was that?
I would say 10 years ago.
10 years ago.
10 years. See how shorter this is compared to this. I'll just make it a little bit more obvious for you, but you can see. This line.
Quarter?
Yeah.
Yeah, I know.
This is a very powerful cellular revitalizer. What it'll actually do is it'll make each cell more fluid. It'll correct each cell, but remember, Tracy, what it does more than anything is it tells one side what the other side should be like. And just sit back down.
My God. It's completely even, honey. That is crazy. Just it's wild at how fast it works.
It's incredibly fast because you're working for the first time at a DNA level. Everything else works at here's a disease, let's kill it. Here's an infection, let's destroy it. Here's arthritis, let's do this or whatever with it. And if we just correct the DNA, it's a domino effect. One cell tells the other, it's bang, 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 bang.
I have diabetes, severe, and many broken bones. The first 2 injections that I received within 10 minutes were phenomenal. Pain went away, and then 15 minutes later, an eye that I haven't seen out of in 61 years due to some scarring tissue, decreased by probably 90%, loss of vision, and it's constantly improving.
You know, when we started 4 days ago, all his hair, and his beard's even starting to turn brown, but it was literally all his hair from here to here, the whole head, white, like the sheet of a bed. And now, basically there's really almost no white on the back of the head, or on the top of the head.
My dad was diagnosed with stage 4 lung cancer, and his prognosis was, according to the doctor, was 2 weeks to 2 months to live. So now we come back and we're looking at the metastases on the organs, I think 2 on the left lung, 1 on the right, and maybe the liver. And I think it was, don't quote me on whether it was the liver was gone or the 2 spots on the left lung were gone, but nonetheless, within the 3rd week or the 4th, they were all gone.
So I had Hashimoto's, which is, it's a thyroid condition. It's an autoimmune disorder where your thyroid attacks itself. So I came to see you a couple weeks ago, right? So he treated me just for 2 days.
She had big ass nodules on her thyroid.
Yeah,
It did feel
huge.
like a lunar crater.
Yeah. And those were, you can see, like I've had pictures of them taken. And
they're gone now, right?
They're gone. Yeah, they're gone. Ever since then, I've been feeling really good, progressively getting better, and just the main thing is that I'm off all my medication, which is I don't know. I mean that's huge. I mean when you tell people, they just don't believe you. They don't believe that you're off your medication.
It was about 12 years ago, and at the time I had been going to doctors throughout the US, mainly in Los Angeles, and they had basically diagnosed me with scleroderma and given me about 10 years life expectancy. I was 27 at the time. Now I am 47, thanks to Sam. She had also gotten in touch with, I believe, 8 or 9 other women that were also affected. She and I went. The 8 other people did not go, and my understanding, within 2-3 years, those that chose not to go are no longer alive.
During Dr. Chachoua's trial with Cedars-Sinai, Dr. Chachoua arranged for Michael Pope to have his blood tested at Cedars-Sinai Medical Center. Their tests below showed full-blown AIDS. Michael was then treated with the last dose of vaccine created from the lost cultures. He was then sent back to Cedars for repeat testing. His immune system had doubled. He was no longer in full-blown AIDS. He was in remission. This had happened before the jury in the space of 12 hours. An AIDS patient was put into remission overnight, and Cedars, who claimed lack of proof, had proved it. Doubling the immune system of a patient in full-blown AIDS is a medical impossibility. Having it happen overnight is miraculous. Having it documented by Cedars-Sinai Medical Center before a federal court is indisputable. In that moment, the jury saw the truth. In that moment, the world should have.
Right now, I have the cure. I have several cures for multiple diseases. Remember the cultures that I had developed. Correct DNA structure, there's almost nothing they can't do. But whereas I used to have an organism that did that for me, now I have to do it mechanically in a lab, and the costs have gone from being a few $100s to being hundreds of thousands of dollars. Astronomical. And I can't bear these costs alone, and most people can't. But the cultures can be recreated. And when they are recreated, the work can be done. A cure for cancer or AIDS can be in your hands for $200-300. A prevention for AIDS, $5. Ridiculous numbers for what they offer. And all it takes is for you to be aware of what is and what was. Ask yourself why people are pouring billions of dollars down the toilet, which is the cancer research industry, when none of these pathways have ever worked before. Ask yourself how this could have been on national news, and yet you never saw it, or you never did anything about it. It's only a question of time and money. It's only a question of directing people to research which cultures can infect cancer cells and leave healthy cells alone, which organisms can correct HIV and make it inanimate or destroy it. It's a very simple process. Now, does the story have a happy ending? Well, that's really up to you, isn't it?